the patient who doesn't know he was going blind. Have you ever met someone who was losing their visions but had no idea it was happening? Today, I want to tell you the story of Michael, a 58-year-old mechanic who came to my clinic thinking he just needed stronger reading glasses. Michael sat down, smiled and said, "Doc, my glasses ain't cutting it. I just need a new pair." But during his peripheral vision test, he kept missing lights on the screen. Left side, upper side, again and again. He laughed it off, but it wasn't something I could ignore. When I examined his eyes, the truth appeared immediately. His optic nerves were deeply cut, the inferior rim was thin, and his pressure were higher than normal. His visual field already showed significant loss. I took a deep breath and said, "Michael, you have glaucoma." He looked confused. "How? I can see fine." But the danger of glaucoma, early on, there are no symptoms, no pain, no redness. Your central vision stays sharp while the side slowly disappears. The brain fills in the missing gaps, hiding the damage until it's advanced. I'll explain to him that glaucoma happens when pressure inside the eye damages the optic nerve. Sometimes the pressure is high, sometimes it's normal, but the nerves becomes vulnerable. Risk factors include age, family history, thin corneas, long-term steroid use, myopia, and certain ethnic backgrounds. Michael paused and said, "My mum went blind in one eye. I thought it was old age. It wasn't. It was glaucoma." I showed him his visual field scan. He had a classic superior nasal arcuate defect, area of missing visions he doesn't even notice. He shook his head slowly and said, "Why didn't I feel this happening?" Because glaucoma is a silent death. It steals visions quietly without any warning signs. And once the vision is gone, it cannot be restored. He looked at me and asked, "So what do we do now? Can you fix it?" I told him the truth. We can't bring back the vision that's already lost, but we can stop it from getting worse. We discussed management, eye drops to lower pressure, prostaglandin analogs, beta blockers, carbohydrate and carbonic anhydrate inhibitors, laser therapy like SLT to improve fluid drainage, and if needed, surgery such as trabeculectomy, tube shunts, or minimal invasive glaucoma procedure. Michael agreed to start treatment that day. He realized glaucoma wasn't something you wait on, you act immediately. I also explained preventions. Glaucoma cannot always be prevented, but blindness from glaucoma can be. Regular eye exams after age 40, especially if you have risk factors, never ignore vision changes, and never assume you are fine just because you can still see clearly. 6 months later, Michael returned for review. His pressure was lower, his visual field was stable, and he told me, "I told all my brothers to get checked. I'm not going blind without a fight." And that's the message I want you to take away. That glaucoma doesn't knock, it doesn't ask permission, It just takes your visions quietly, year after year, unless you catch it early. So what Michael almost didn't do? Get your eyes checked. Save your visions before the silent death steals it.